Hi guys, so I wanted to show you this report from Sky News. It's about the critical situation in care homes in England, and many of them are close to bankruptcy because they haven't been receiving sufficient funding and support from their respective councils since the beginning of this crisis. So let's hear what they have to say.
Some care homes were struggling financially even before the outbreak of coronavirus. But Sky News can reveal a group of care homes in the northeast of England have taken the unprecedented step of legally warning the council if they don't take action to help them financially within 5 days, the market will start to collapse. We've obtained a leaked copy of a letter from 21 care homes to North Tyneside Council declaring force majeure or a major incident. The letter says, the care home market within North Tyneside is facing imminent collapse due to the council's conduct in the lead up to and during the current COVID-19 pandemic.
So the problem is that many of these care homes are being forced to spend a lot of money on, for example, PPE for their staff, but they're not receiving the support from the councils to do this. Now, why are the councils not doing this? Well, there are a number of different reasons, but one particular reason is because of austerity. The austerity that Tories have imposed on the UK for a number of years now, this is coming back to bite the Tories, the government and the country in general in the arse. The councils are struggling. They don't have the resources to buy equipment for these care homes, and many care homes are deciding to buy it themselves. But if they are a profit-driven business, then this is going to eat into their profits, and many of them can't survive.
It goes on. The council has failed to provide sufficient and timely financial support to care home providers to meet the additional costs they're incurring due to COVID-19. As vacancies increase due to deaths with fewer and fewer, if any, new admissions, the running of homes within North Tyneside is becoming increasingly unsustainable.
So the problem here is that you have care homes. These are businesses. Okay, I'm going to come back to that in a moment. They need full capacity in order to make a profit. So if their care homes are full, then they're able to survive. But because many people are dying and fewer people are being placed in care homes, because of course family members are worried about their elderly parents or relatives going into these care homes, so they're not bringing them forward to be placed in care homes. So this is causing the care homes to have more vacancies, more capacity, which is a problem for them because they need to have these care homes full in order to operate at a profit.
The largest representative body for social care in the UK is Care England. I asked them to comment on the letter. We already knew that the care sector was really struggling financially to deal with this pandemic, but how much more serious is it to declare a force majeure or major incident?
Declaring this force majeure is something that has never really happened before. So this tells us that we are in the midst of perhaps the worst situation we have seen in modern times.
What would you say to people who have relatives in care homes and nursing homes in this country?
Care providers will be doing everything to make sure that the care is as good as it possibly can be and that people have good lives. Where they should worry is whether or not these services are sustainable for the long term.
Declaring force majeure essentially frees both parties from their obligations under the contract due to extraordinary events.
In certain specified circumstances. Those circumstances would normally include such things as war, riot, acts of terrorism, earthquake or flood or whatever.
In a statement, North Tyneside Council said, "We're working hard together to keep staff and residents safe. Occupancy levels have been affected by the pandemic, and we're aware levels have fallen below where they were ordinarily expected to be. Where this has happened, we're working with those providers directly in line with our statutory duty."
Also, something to comment on is that in many cases, patients who are in care homes receive funding for the cost from the state, from the local council. So if the council isn't giving money, the care home is suffering. But also if the numbers of patients in the care homes drop, then the care home has less liquidity.
It's not just the northeast of England where anger is growing about the costs of combating coronavirus in care homes.
We were buying from independent providers. I know some providers who have got stung with the scams. Large groups have paid large deposits and lost those. We were thankfully ahead of the curve, so we had sufficient to keep us rolling, but then we were paying exorbitant prices for masks and gloves.
What happened was, he mentioned the scam. So there were many care homes who, at the beginning of this crisis, rushed out and bought whatever PPE was available, because the government had provided nothing. So they had requested from the government in London and the Department of Health PPE equipment and gloves, masks, whatever, but they weren't getting anything, and so they had to buy it themselves. And of course, you know, a care home doesn't have the proficiency or the knowledge on how to source this type of equipment, so they were getting scammed by unscrupulous business owners.
Some care homes say they feel they've been pushed to take drastic action, and they're still fighting the devastating impact of coronavirus. Lisa Holland, Sky News.
So what I wanted to talk about here is, why is this in the private sector? This should be nationalised. Care homes should be the responsibility of the Department of Health. Why is it private companies that are running this industry? This is the problem of privatization. You privatize something that should not be privatized. Now, I'm not against all privatization, but when it comes to health, education, care, for example, for the elderly or the ill, this cannot be a business. This cannot be profit driven. Now what we're going to see is many care homes close, and the government will have to pick up the pieces. Now, a reasonable government would probably say, okay, this was a bad idea. Privatization of this part of our society was a mistake. We should actually nationalize this. But I don't think the Conservatives are going to do that, because unfortunately for some people it's still very profitable. So they will not like the Tories to nationalise it. They would probably donate to the Tories, or at least call up their politicians who they've donated to remind them that they made those donations. This is a business that should not exist. It should not be a business. This should be something provided by the state to all citizens, and it should be free. There shouldn't be a situation where elderly people have to sell their homes in order to go into care. There shouldn't be a case of people getting into their children, younger generations, getting into debt in order to make sure that their parents are able to have a number of years in a comfortable care home. This should be provided by the state. It should be free. If we have to increase taxes to do that, then so be it. But it's completely ridiculous to me that this is a profit-driven sector. This is why privatization should not be in place in health or education. In this case, health. The health of the elderly and their care. I really hope that because of this crisis, we're going to start to see much more investment from the public sector into the state into this particular industry. And we should see the end of private care homes, because it should not, as I said before, it should not be profit driven. It should be something that we as a society decide is important for the people who have come before us. Let me know in the comments, guys. As always, your comments are greatly appreciated. Thanks. Why not become a Patreon and enjoy access to our Discord server where we share news, chat, and have some fun? If you become a patron, you can also make video suggestions on topics that are important to you. Check it out via the link in the description.